Benign prostatic hyperplasia, or BPH, is simply a non-malignant enlargement of the prostate called an adenoma. This gland, located below the bladder and around the urethra, plays an important role in the male reproductive system. As men age, the prostate can increase in size, and this can cause bothersome urinary symptoms. Benign prostatic hyperplasia, or BPH, is not a new condition. Mentions of it appear throughout history, though often without the precise medical terminology we use today. Ancient Egyptians documented urinary problems, likely linked to BPH, as early as 4500 BC. Hippocrates, the father of medicine, described procedures to address urinary blockages, likely caused by enlarged prostates. During the Renaissance, advancements in anatomy provided a clearer understanding of the prostate gland. However, effective treatments remained elusive. The 19th century saw the invention of the cystoscope, allowing doctors to visualize the inside of the bladder and urethra. This marked a turning point in diagnosing and understanding BPH. The 20th century brought significant breakthroughs in BPH treatment. Surgical techniques improved dramatically, and the development of medications offered new hope for managing symptoms. Today, our understanding of BPH continues to evolve, with ongoing research exploring innovative treatment options and preventive measures.
The exact cause of BPH remains unclear, but age is a primary risk factor. As men age, hormonal changes occur within the prostate gland, potentially leading to cell overgrowth. Dihydrotestosterone, or DHT, a hormone derived from testosterone, plays a significant role in prostate growth. While the exact mechanisms are complex, increased DHT levels or increased sensitivity to DHT within the prostate may contribute to BPH development. Family history also seems to play a role, suggesting a genetic component to the condition. Men with close relatives who have experienced BPH are at increased risk. Other factors, such as obesity, diabetes, and heart disease, may also influence BPH development. However, more research is needed to determine the exact relationship between these conditions and BPH. Understanding the factors that contribute to BPH is crucial for developing effective prevention and treatment strategies.
BPH typically develops gradually, with symptoms often subtle in the early stages. As the prostate enlarges, it can compress the urethra, the tube that carries urine from the bladder. This obstruction can lead to a variety of urinary symptoms, which often worsen over time. Common symptoms of BPH include weak urine stream, difficulty starting urination or maintaining a steady flow, urinary hesitancy, a delay between the urge to urinate and the actual flow of urine, intermittency, stopping and starting several times during urination, dribbling, a small amount of urine leaking after urination, urinary urgency, a sudden strong urge to urinate, nocturia, frequent urination at night. These symptoms can significantly impact quality of life, causing discomfort, embarrassment, and sleep disturbances. It's important to remember that BPH symptoms are not always indicative of the severity of the condition. Some men with large prostates experience few symptoms, while others with smaller enlargements have more bothersome symptoms.
If you're experiencing urinary symptoms, a visit to a urologist is essential. The urologist will conduct a thorough evaluation to determine the cause of your symptoms and rule out other conditions. This evaluation typically includes a detailed medical history, physical examination, and potentially some diagnostic tests. During the medical history, the urologist will ask about your symptoms, their duration, and any factors that seem to improve or worsen them. They will also inquire about your overall health, medications, and family history. The physical exam often includes a digital rectal examination, or DRE, allowing the urologist to assess the size, shape, and consistency of your prostate gland. While the DRE might seem uncomfortable, it's a quick and essential part of the evaluation. The urologist will insert a gloved, lubricated finger into your rectum to feel the prostate, which is located just in front of the rectum. This examination helps determine if the prostate is enlarged, tender, or has any unusual nodules.
Diagnosis and differential diagnosis of BPH. Diagnosing BPH involves a combination of clinical evaluation, symptom assessment, and diagnostic tests. The urologist will consider your medical history, physical examination findings, and the results of any tests performed. It's important to rule out other conditions that can cause similar symptoms to BPH. This process is called differential diagnosis and might involve considering conditions such as prostatitis, inflammation of the prostate gland, which can be caused by infection or other factors, urinary tract infection, UTI, an infection affecting the bladder, urethra or kidneys, prostate cancer, a malignant tumor of the prostate gland, bladder stones, hard deposits that can form in the bladder, causing urinary obstruction. By carefully considering all possibilities and performing appropriate tests, the urologist can make an accurate diagnosis and recommend the most effective treatment plan for your specific situation.
Laboratory and imaging studies for BPH. Laboratory and imaging studies play a crucial role in diagnosing BPH and ruling out other conditions. These tests provide valuable information about your urinary tract and prostate health, helping the urologist make informed decisions about your care. Common tests used in BPH diagnosis include urine test, urinalysis, checks for signs of infection, blood, or other abnormalities in the urine. Blood tests may include a prostate-specific antigen, PSA test, which measures the level of PSA in the blood. Elevated PSA levels can indicate prostate cancer, but can also be elevated in BPH. Uroflowmetry measures the speed and volume of your urine stream, providing objective data about urinary flow. Post-void residual, PVR measurement, determines the amount of urine remaining in the bladder after urination, which can indicate incomplete bladder emptying. These tests, along with the clinical evaluation, help create a comprehensive picture of your condition and guide treatment decisions.
The importance of ultrasound in BPH diagnosis. Ultrasound is a safe and painless imaging technique that uses sound waves to create images of internal organs. In the context of BPH, ultrasound plays a vital role in visualizing the prostate gland and assessing its size, shape, and any abnormalities. There are two main types of ultrasound used for BPH: transabdominal ultrasound, performed by placing an ultrasound probe on the abdomen, providing a general view of the prostate and bladder. Transrectal ultrasound, TRUs, involves inserting a small ultrasound probe into the rectum, allowing for a more detailed examination of the prostate gland. Ultrasound helps determine the size of the prostate, identify any areas of blockage, and rule out other conditions, such as it also assists in planning treatment, such as surgery, by providing precise measurements and guidance. Managing BPH pharmacological treatment approaches. Pharmacological treatments, or medications, are often the first line of treatment for BPH, especially in cases with mild to moderate symptoms. These medications work through various mechanisms to improve urinary flow and reduce BPH symptoms. Common types of medications used for BPH include alpha blockers, which relax the muscles in the prostate and bladder neck, making it easier to urinate. 5-alpha reductase inhibitors, which block the conversion of testosterone to DHT, shrinking the prostate gland over time. And combination therapy, which involves using both alpha blockers and 5-alpha reductase inhibitors for enhanced effectiveness. The choice of medication depends on the severity of symptoms, individual patient factors, and potential side effects. It's important to discuss the risks and benefits of each medication with your urologist to determine the most appropriate option for you. Surgical treatments for BPH. While medications manage BPH symptoms for many, surgery might be necessary if medications haven't provided relief or complications arise. Conventional surgical techniques for the treatment of BPH are transurethral resection of the prostate, TURP, endoscopic myocapsulotomy, CM, or transurethral incision, ITUP, and open surgery, or adenomectomy. The choice of one or the other depends fundamentally on the size, shape, and type of prostatic growth. Minimally invasive techniques offer effective solutions with shorter recovery times and fewer complications. Options include TURP, the gold standard, which removes excess prostate tissue, Myocapsulotomy consists of performing a prostatic incision. The main indications include young patients to preserve antegrade ejaculation with small adenomas. Photoselective vaporization of the prostate, PVP, uses a laser to vaporize prostate tissue. PVP causes less bleeding and is suitable for patients taking blood thinners. Open adenomectomy involves the removal of the prostatic adenoma. It is an invasive technique that is not free from morbidity and mortality. The most frequent early complication of open prostate surgery is hematuria, which frequently requires the transfusion of blood products. There are other techniques such as laparoscopic adenomectomy, with or without robotic assistance, the latter being a technique that allows better control of bleeding and a short recovery. The choice depends on prostate size, health, and surgeon experience. If you like our content, give us a like, subscribe, activate the bell, and share this video so more people can see it. Living with BPH. Tips for managing symptoms and improving quality of life. Lifestyle modifications can play a significant role in alleviating symptoms and improving quality of life. These changes can complement medical or surgical interventions. Here are some tips for managing BPH symptoms. Limit fluid intake before bedtime to minimize nighttime urination. Avoid caffeine and alcohol to reduce bladder irritation. Practice pelvic floor exercises to improve bladder control. Maintain a healthy weight to reduce BPH risk. Manage stress to prevent exacerbating urinary symptoms. Incorporate these changes and follow your treatment plan to manage BPH effectively.